Hello guys, how are you? I hope you are doing fine. Today I will be discussing about domestic violence. Domestic violence. Domestic violence, or basically NAI, okay? Before I discuss about domestic violence or NAI, simply I would like you to know that we have three types of scenarios. I will say it verbally like this so you understand it. You understand the concept, okay? We have three types of scenarios. We have the middle one, which is an adult like me, 35 years old, male, female, 25, 29, 30, 35, 40, an adult who is getting abused at home. And the adult can be abused by, for example, a partner, can be abused by anybody. And I have younger version, which is child, elder version, which is elderly. So I have three scenarios where people are getting abused. I have a female or male adult, I have child, I have elderly. The only difference will be in management. The only difference will be in management. If the case is a female who's getting abused, or a male who's getting abused, adult, you cannot force admission. You offer help. You offer referral to social services. You offer support system. You can tell them that at any time you can ring the police, but if they don't want, it's optional. It is optional. However, children and the elderly, they will be kept by force. What I mean by force? You will inform social services who will be involved and who will take care of the whole issue, and the child is not going to go home, or the elderly is not going to go home unless the social services involved. Why, Dr. Mo? Very, very young, very, very old, cannot defend themselves. Cannot defend themselves. That's why we keep them. Social service will be involved and will keep them. Adult can defend himself or she can defend herself. That's why we only advise. But if she doesn't want the social service to be involved, if she doesn't want, and if she wants to go home, we cannot keep her here. She will go. Okay, that's the only difference. So again, we have three scenarios. Very, very young, very, very old. We're gonna involve the social services. We're gonna keep them until the social service will be involved. We will not send them home. We have the middle scenario, which is an adult, male or female. We're gonna advise them. We're gonna tell them that we should involve social services. They will be involved, and it will be for your own benefit, and that will be good for you. But if they're not happy with it, they have the right. Okay, that's one thing in management. In terms of when I manage the situations, is different. However, sometimes they bring a female who is adult, who is 35, but she's pregnant. She is pregnant. In this case, do we admit or not? Still you don't admit. Still you don't keep. It doesn't mean that she has a baby inside, that I will keep her by force because she has a baby inside. No. I will be dealing with the situation as if she's an adult. Only when the child is out, then we can keep the child. As very, very young, very, very old, we can keep them. But if she's pregnant, that would not make any difference in that case. If she is pregnant, that would make any change in the scenario. If she is pregnant, it's fine. We're going to advise her. We're going to tell her about the risks of her getting abused while she's pregnant. That may risk the baby. The baby might have serious troubles, and that will risk her pregnancy. But if she's not happy with admission, if she's not happy to for the social service to be involved in everything, then it's okay. We're going to advise her, and that's it. And social services will be involved later on when she has the baby. But because then we can have access to the baby. But here, it's fine as long as the baby is inside. If she's pregnant, that wouldn't make any difference in management. I just give you a recap of when I manage the three cases. The only difference is, do I admit? Do I keep them in the hospital? Do I keep them and they involve social services and they will be admitted or not? Depending on the three situations. Number two, which is history. In history, what should I do in history? So in history, my history will be, in one word, environment. My history will be in one word, environment. Environment means that whenever a patient is coming to me and the case is abuse or NAI, I will ask about the environment. Environment means who lives with this person, who lives at home with this person, and the relationship between this person and everybody else. Imagine if me and my mom and my dad and my sister living together and I'm getting abused. Can my sister be abused as well? My dad is abusing me. Can he be abusing my sister? Yes, he can be abusing my sister. Can he be abusing my mother? Yes. So always ask about every single person at home and the relationship, because maybe you have a case, a female, 35, coming, domestic violence abuse. You're not going to admit her, but there's a child there who's getting abused as well that will need admission. So always ask about the environment. Who's at home? How's the relationship between this person and everybody else at home? Anyway, so domestic violence, abuse cases, I've told you 3 different scenarios, how to manage them, and I said to you in history, you must ask about the environment. So let's start. When I have an NAI case or abuse, domestic violence case, when I open the door, what's gonna happen? I'm gonna see a patient, I'm gonna see a person who is anxious, worried, doesn't wanna talk, doesn't wanna give me much history because she is scared. So here, acknowledge, I can see you are anxious. I can see you are worried. I can see you are a bit scared. Can you please open for me? I'm here to help you. I'm only here to find solution for anything you are going through. So that's one thing. So always the difficult problem here is making the patient open. When the patient opens, then can you please tell me what happened? So in that, you will ask about the environment. Environment. Who do you live with at home? For how long have you been with this person at home? For example, if the partner is the one abusing, okay? For how long have you been together? How's everything at home? How's the relationship between you and your partner? So this is the relationship between that person and the person at home. Then when she tells you, for example, he's been calling me words or he's been humiliating me, so always ask, for how long has this been going on? So explore the complaint that she's coming with. For how long has this problem been going on? Have you ever tried to find a solution for this problem? Then ask about the partner. So number 1, the complaint. So number 1, let the patient open. Try to make the patient open. Acknowledge what you can see. Always offer help. Number 2, ask about what's happening. Complain. She's been abused verbally or whatever. Explore since when, how did it start? Okay. Then ask who do you live with, how's things at home, the relationship between you and your partner. Then ask about that partner. The partner. Which means, does the partner has any mental problem? What does he do for a living? What does he work? What job does he do? Is he managing financially? Because maybe finances will be a stressor. Does he smoke? Does he drink alcohol? Does he take any recreational drugs? That's about the partner. So always when you have the partner, ask about smoking, recreational drugs, work, finances as a kind of stressors. Then, apart from you and your partner, who's at home? Who else at home? So ask about everybody else. So the person who's getting abused first, you need to ask about. Then whoever you think is abusing him or her, you need to ask about. Smoking, alcohol, under recreational drugs, job, finances. Then anybody else at home. You need to ask about. Like children, like maybe her father is getting abused, maybe her mother is getting abused, maybe other children are getting abused, and the relationship between the abuser, the partner, and whoever you're suspecting to be abusing, and everybody else at home. Then outside the home is family and friends support system. Do you have any family nearby, any friends nearby? Do you speak to them? Have you ever told them about this? Do you have an emergency plan? So support system. So whenever I have a case of domestic violence or abuse in history, I have steps. Step one is offering, is acknowledge what you can see. I can see you are anxious, I can see you are worried, I can see you are irritable. Acknowledge what you can see, plus help the patient to open. That's step one, which means I'm here to help you, open for me, Everything will be confidential, okay? Step 2, after she started opening, she will give you a complaint. So step 2 is the patient herself. The patient herself, which means if she's being verbally abused or physically abused and so on, how did it start? What does he do? What does he do? Have you tried to speak to him? Why does he do this? Okay? So ask about her herself. Step 3 is asking about the abuser, the partner, for example, the one who's abusing. What does he do for a living? Is he managing financially? Does he drink alcohol? Does he take recreational drugs? Step 4 is people around at home. People at home in terms of who else at home, who else at home, who else at home, like mother, father, children, and how is the relationship between the partner and whoever at home. Step 5 is outside home support system. Support system, which means neighbors, relatives, friends. Have you spoken to them? Have you told them? What did they tell you? Do you have an emergency plan? So people at home or the neighboring. Okay, so this will be my history, which in one brackets, in one word, environment. Environment. All this I will put it in one word, environment. Environment. Okay? After that, you will verbalize examination. You will verbalize examination, general physical examination, and after that, management. Okay? That's it. This is the structure. This is the structure. And in management, I told you, always very, very old, very, very young, keep. In the middle, you don't keep. Okay? Okay, so the first scenario, you are an FY2 doctor in the pediatric department. So the first scenario is pediatric. So don't forget that in this case in pediatric, management, admit or not, because it's a crucial point, admit. So you are an FY2 doctor in the pediatric department. 4-month-old Jack has been brought to the hospital by his mother this morning, okay? She brought him to the hospital because he's having swelling in his arm. X-ray done, showed spiral fracture. That's it, confirmed. Spiral fracture is a fracture when the arm is twisted. So X-ray showed spiral fracture. In brackets, they are telling you it is confirmed abuse. X-ray showed spiral fracture, diagnosed, right humerus. Talk to the mother. So it is a confirmed abuse. Swelling in the arm, X-ray is done, spiral fracture, confirmed. So it is an abuse case, child abuse, okay? So this is the first scenario, very, very young. So now, when you come, how can I help you? Doctor, I can see from my note that you brought your son and he's having injury in his right arm. Yes, explore the presenting complaint. How did it happen? When did it happen? Were you there? Explore. When you explore, she will tell you that it happened last night. I've seen it this morning. Okay, who was looking after him? My partner. So whenever she tells you my partner, always ask, did you ask him about it? Did you ask him how did it happen? And then go for, is he the biological father? Is it planned pregnancy? Which means that is your partner is the father, biological father. If she said yes, is it planned pregnancy? So if this pregnancy was planned or not? Yes. Have you brought him before for any other injuries? Yes, no. Then how's the relationship between your partner and your son? Okay. Things like this. All right. So when you ask about the relationship between the partner and the son, always ask about anybody else at home. How's the relationship with your partner and everybody else at home? And always ask about her partner. What does he do for a living? Is he managing financially? You need to look for any stressors. Does he drink alcohol? Does he smoke? Does he take recreational drugs? So always ask questions which are stressors. So presenting complaint is the patient, child himself, as I told you, questions. Then her partner, questions. Then people at home, questions. Everyone else at home. Then support. Okay. So what are the positive findings here? Okay. So the mother is really worried. She was at work all night. She came in the morning. She noticed this is swelling. She rushed him at the hospital. Guys, rushed him at the hospital is positive to tell you that the mother is caring. But it doesn't really matter. Even if she's caring, the child is getting abused, you will keep in the hospital. But it shows you that she's caring, because delayed presentation, whenever you ask when did that happen, if she said to you a week ago and she brought him today, delayed presentation is equal abuse. Delayed in presenting the child. Did you witness it? Did you witness the event? Has it happened before? Was it the first time to happen? Did you ask your partner what happened? She will tell you, I've asked him, he left me. Is he the biological father? He's not the biological father. Okay? And then ask about the environment, who else at home, how's the relationship between the child and everybody else at home. Then when you examine, when you verbalize examination, verbalize, only verbalization. Then when you managing this case, simply, you will do full skeletal survey. CT head, all bloods. So you will do bloods to exclude anemia. Maybe they don't feed him properly, maybe you will do full skeletal survey and you will do CT head. So CT head, full skeletal survey. Will he be admitted? Definitely, the child will be admitted. Definitely. So number 1, admit. Number 2, senior. Number 3, investigations. What are the investigations? Blood, all blood. Image, full skeletal survey, CT head, and even pictures. They will take pictures of the injuries. Okay, they use it for medical legal. Step 4, symptomatic, painkiller. There is a fracture, stabilization, the fracture, and orthopedic, referral for treatment. And finally, will involve social services. And always, when you talk about social services, mention it last. And always say, well, will involve social services. She will be angry. She will tell you, am I abusing my son? Say to her, well, they will take my son from me. Well, social doesn't mean that I will involve social services, that they will take your son from you, because social services are specialized organization that their main concern is not taking the children from their family, but their main concern to make sure that the children are safe under their family care. Okay, so that's involving social services. All right, so this is the management. So the management, should I admit or not? You must. Investigation, we know investigation, and treat the spiral fracture, which is stabilize the fracture. Your job is to stabilize, not to fix. Then orthopedic, referral, and finally social services. Okay. Second scenario, you are an FY2 doctor in the Obs and Gynae department, 12 weeks pregnant, Alicia. She's 28 years old, presented to the hospital with vaginal bleeding. She is under the antenatal checkup. Okay, ultrasound was done and showed the 12 weeks of pregnancy. Okay, everything was normal. The nurse noticed bruises on her right thigh, and then she informed you. So this case is bruises on the right thigh on a female who presented for antenatal checkup. She's 12 weeks pregnant. Okay, the principle is, does it mean that she's pregnant that I will keep her by force? No, doesn't mean anything. Because the baby is in, I cannot keep her by force. That's the end of the management. So history. She will be anxious, acknowledge. Then I can see from my note that the nurse, that you are coming for the checkup. Thanks for coming to see us today. I can see from my note that the nurse has noticed that there are some bruises in the right thigh. Has she told you about it? Do you have an idea about it? Do you have an idea why you're having these bruises? Yes, no, explore the bruises. Talk to the patient about the patient herself. So that's number 1, patient herself. Do you know when you had these bruises? How did you have these bruises? Have you had it before? She's not opening, offer confidentiality, but not right away confidentiality. I'm here to help you. Try to tell me. I'm only here to make sure that everything is okay. Then she will tell you, it's my partner. Talk about the partner. Does he abuse you verbally, emotionally, physically? What does he do? Why does he do this? Have you spoken to him about it? Okay, and then, is he the biological father? Is he the biological father of the baby? Was it planned pregnancy? Then people, who else at home? Because maybe there's a child at home who's abused. So who else at home? How's the relationship between your partner and everybody else at home? how's things at home, ask about the partner, job, how does he manage financially, recreational drugs, alcohol. Then support. Have you told anybody about it? If things go wrong, what's your plan? What's your emergency plan? Have you spoken? Do you have any relative nearby, family nearby? Have you spoken to them? Management in this case. Management is. Do you admit? No. Offer support. Offer support. Tell her, I would like to keep you in the hospital. But if she said no, it's no. You cannot force. I will talk to my senior who would like to keep you in the hospital because I can see that you are not safe at home. You have bruises. No, doctor, I don't want to stay in the hospital. Okay? We need to keep you, to offer you all the support. Okay? This time that the baby is okay, but later maybe something will be serious happening to the baby. No, doctor, I don't want to stay. We can involve social service if you want. They will offer you help and support. No. But if no, she has the right, so you only offer. Then you can tell her, do you have an emergency plan? Do you have an emergency number? We can give you an emergency number. If things goes wrong, you can call. You can call the police. There are groups like domestic violence or national domestic helpline number. National domestic helpline number, which is a phone number that you can call if you need help. You can involve the police. You can ring the police in case things go wrong. So if things go wrong, you can ring the police. If things go wrong, you can ring the police. Okay, but you cannot force admission. Scenario 3, you are an F5 doctor in the A&E, Mrs. Black, 85. Now we are talking about the third scenario, which is very, very old. 85 years old, brought to the hospital by her daughter because she had a fall. There are multiple bruises, different ages, which means she's been abused for a while. Multiple bruises, different ages in her body. Okay? There is tenderness in her body. Talk to her daughter. Okay? The lady has been sent for x-ray and talk to her daughter. Clear case of abuse. So, what is the presenting complaint? Fall. You are talking to the daughter, confirm the daughter's name, confirm the mother's phone name and date of birth. First of all, she's 85 years old. Do you admit or not? Yes, I will admit. Do you keep her by force? Yes, I will keep her by force. If the daughter is refusing, no, she will be kept because she is very, very old. That's the key for passing the station. So the key for passing such a station, if the person should be admitted and you don't, you fail. Because that means that you are not safe. So in this case, you will explore the fall. How did it happen? When did it happen? Is it the first time? Did you witness the fall? Did she lose consciousness? Did she injure her head? Explore all about the fall. Number 1, patient herself. So patient herself means the fall. Number 2, the daughter. How is the relationship between you and your mom? And the daughter is like the partner in the previous case. The daughter exactly like the partner in the previous case, which means she's the one that I'm suspecting her to be abusing. So what do you do for a living? What job do you do? How's your finances? Ask her if she drinks alcohol, if she takes recreational drugs. So I'm trying to establish the stressors, things that can cause her stress in life, and then she can be abusing her mom. So stressors. Okay, then anybody else at home apart from you and your mom, because maybe there's anybody else who's abusing the woman or anybody else who is getting abused, anybody else at home, how's the relationship and everything. Okay, then support in this case. So what are the positive findings? Daughter did not witness the injury. Her mom was getting ready to go to change her clothes. Past medical history of the mother, dementia. The daughter working office job. Okay, work long shift. It's a risk factor. She cannot look after her mom. She's having a financial problem and she cannot support her and her mom financially. Examination, always verbalize examination head to toe. Always verbalize examination. Always verbalize examination head to toe. In this case, senior, admission, further investigation. What are the further investigation? Like the child exactly. Full skeletal survey, CT head, blood to check for vitamins, full blood count to make sure that she's well fed. Okay, so exactly like children, blood, full blood count, renal function, vitamins, urea electrolyte, full skeletal survey, CT head. Then involve social services. Tell her we would like to involve social services. She will be angry. Say to her, well, I know you are a concerned daughter. We are worried about your mom. We are caring for your mom. We need to make sure that she is well looked after, and I'm sure that this is your main concern as well. Okay, so that's one scenario. One scenario is that she does not know and she did not witness the fall. There is another scenario where she will tell you, I witnessed the fall and I pushed her and she regret. The daughter has witnessed the fall and she told you, I pushed her and she regrets pushing her mom. But again, that would not make any difference in the case. So again, this is another scenario. There's another scenario where she witnessed the fall and in fact she's the one who pushed her mom and she's regretting it. Nothing. You will explore, how did the fall happen? When did it happen? How did it happen? Has it happened before? Before it happened, why did you push her and everything? The partner, which is the daughter. How is the relationship between you and your mom? What do you do for a living? Your job, stressors. Yeah, do you drink alcohol? Do you do recreational drugs? Everything. Are you managing financially? Are you managing looking after your mom? People. Who else at home? Who looking after her apart from you? Okay? She regret. It doesn't make any difference for me. Bloods, CT scan, full skeletal head, full skeletal survey, admission, senior, social services. So that would not make any difference. It will still be the same case. All right, guys. So the purpose of this station: do I admit or not? If she's pregnant, would it make any difference or not? That's the purpose of these stations. And always try to make the patient open. Always try to be nice with the patient. Always open, let the patient to open slowly, and at the end offer confidentiality, and make sure you ask about the complaint itself, the person himself, the partner or the mother or the daughter, people, everybody else at home, and support system. All right, thank you very much, guys. This is a very important case that appears in the exam all the time. Okay, NAI and domestic violence. Thank you very much. Thank you.